Hello, this is Megan, and welcome to my TED Talk. Would you rather die a slow, excruciatingly painful death, or one that is similar to drifting off into sleep? Most people would prefer the latter. Death is a difficult topic for people to talk about because people would rather not focus on a time in which they no longer exist. However, some people are not given this luxury, and those with terminal illnesses must face the fear of painful death constantly. This does not need to be the case, however. The logical answer is physician-assisted suicide, and, more importantly, a federal law that creates a uniform approach to physician-assisted suicide. First, let's establish what physician-assisted suicide is. Physician-assisted suicide is the act in which a doctor or physician will prescribe a terminally ill patient a lethal dose of medication to enact their death. Physician-assisted suicide is commonly associated with euthanasia. The word euthanasia, used by 17th century Greeks, means good death. How fitting, since the point of euthanasia is to bring mercy upon a suffering patient. It's time to create a federal law regarding physician-assisted suicide. By doing this, the United States would have a uniform policy when regarding this topic, therefore, keeping loopholes and illegal activities to a minimum. Obviously, there would have to be a set of requirements that need to be fulfilled in order to qualify for physician-assisted suicide. The federal law would include the following requirements. 1. The patient must be 21 years or older. 2. Euthanasia cannot be carried out at first knowledge of illness. 3. Their death must occur within 6 months. 4. 2 oral physicians need to corroborate the terminal illness. 5. 1 written physician corroboration. 6. The patient's illness is untreatable. And 7. A psychologist must sign off that the patient is sound of mind. Now for some statistics that you're dying to hear. According to a survey in 2015, up to 81% of young adults from the ages 18 to 34 believed physician-assisted suicide is morally acceptable. The most appealing aspect of assisted suicide is the option to choose where you die. In Washington and Oregon, many people were afraid of dying in a hospital, so they chose the comfort of their own home to pass on. In Oregon, 94% of people prefer dying at home, and with Washington, up to 88% preferred the home route as well. Pros of physician-assisted suicide are: a patient's suffering can end in an instant without further pain. Their death is in their control, rather than out of their control. A patient dies with their pride, as opposed to the former shell of their past self. The cost of healthcare can drop significantly with physician-assisted suicide because of not continuously paying for medical treatment to stay alive. The patient won't commit suicide on their own with no one's knowledge. However, some people argue against physician-assisted suicide. These arguments include it creates a dilemma for doctors that took their Hippocratic oath that swore to prevent hurting and harm to a patient. It creates an opportunity for non-terminally ill patients to commit suicide based off of depression rather than being diagnosed with an actually terminally ill case. It fights religious belief, the belief that suicide is a sin. An example of the benefits of physician-assisted suicide is in the case of Brittany Maynard. In April 2014, she was diagnosed with a malignant brain tumor and was inevitably going to die. Her life could have been prolonged through radiation treatment, but would lead to an extremely painful death, along with her family watching her deteriorate in front of their own eyes. This slow death would have seizures, tremendously horrible headaches, and memory loss. She chose to do physician-assisted suicide and moved to Oregon to die painlessly for herself and to put her family at ease. On November 1st, a day after her husband's birthday. An example of when physician-assisted suicide could have been beneficial is in the case of Danny Bond. Bond was born with an illness in his bowel lining and got an infection because it was left untreated and unknown until he was 11 years old. Because of this illness, he didn't spend more than a few months outside of the hospital. Along with over the course of 20 years, he endured 300 painful and grueling surgeries, living every day with pain. At the young age of 13, he tried to commit suicide twice, but got nursed back to life by the request of his mother. Finally, he decided to starve himself to death and died at the age of 22 in 2011. This is what could happen if physician-assisted suicide does not become a federal standard. Do we really want more Danny Bonds?